this innovation of the National Cabinet. This has been a very important leadership group for this country, bringing together our federation, seeing it work in a way that this country, I don't believe, has ever seen. We get into the room, we get things done, and I thank my colleagues very much for their cooperation and support.
For the first time since its inception, a Premier has left the room at National Cabinet.
Gladys, did you want to make a comment?
Thanks, PM.
And in doing so, has fundamentally changed its makeup.
I guess that's the beauty of the Federation. It allows us to come forward with our own views on how to move forward.
As the senior coalition Premier in the National Cabinet, Gladys Berejiklian was at various times an important ally for Scott Morrison and at other times an important ally for her fellow Premiers. But when National Cabinet met on Friday, confronted by a major decision already made by the PM on reopening international borders next month, there was no one there from New South Wales. The PM had raced out to make his announcement on borders ahead of the press conference where Berejiklian resigned. While the media had been briefed on the border opening, it was news to the rest of National Cabinet.
The time has come to give Australians their life back. We're getting ready for that, and Australia will be ready for takeoff very soon.
I look forward to hearing about that plan. It has not been distributed in any papers to National Cabinet prior to National Cabinet's meeting. I'm not going to agree to anything when I haven't seen any formal paperwork.
Berejiklian's absence kiboshed any chance that National Cabinet could make any substantive decisions about items on the agenda, including international borders. Federal government sources argue that particular decision was not one for National Cabinet anyway, because it is purely a decision of the federal government. This rather overlooks the knock-on effects for states and territories which, apart from anything else, run quarantine arrangements for a federal government that proved itself incapable of doing so. But even before Berejiklian's resignation, the National Cabinet system has been hitting roadblocks, with states refusing to agree or endorse policy proposals, saying they have not enough time to consider them before the meeting.
Look, it has its moments. There are areas where there's really strong cooperation and good information sharing, and then there are other times when you get the sense that papers are being withheld until the last possible moment. Often very late in the evening, the night before the National Cabinet meetings, or sometimes on the day of the meeting, and sometimes even when you're in the meeting, particular papers will arrive.
While the Commonwealth insists it is getting papers out as soon as it can, at last Friday's meeting, the delays prompted leaders to cancel the next 2 National Cabinet meetings, meaning it will not meet again during this crucial pivot month of October for pandemic management. It will only reconvene on November 5. National Cabinet was briefed on Friday on the progress of a paper still being prepared by bureaucrats on the capacity of the health system. But what it did not discuss was a much bigger brawl that has been building between the federal and state governments on health funding. Last Thursday, health ministers, Labor and Liberal, wrote to Health Minister Greg Hunt expressing their alarm and dissatisfaction with funding arrangements for the health system as it approaches its forecast peak demand. The letter signed by every state and territory says hospitals are under unrelenting strain with the extra costs of COVID and calls for crisis funding from the Commonwealth. The states also want the Commonwealth to start chipping in for the care of COVID-positive people staying at home, where the majority of cases are actually managed. The Coalition says it's increased federal funding for hospitals by more than 70% since 2013, but states and territories argue that problems in the health system that have been mounting for years have been brought to a head by COVID. Last year, the federal government recognised the pandemic pressures and agreed to fund its extra costs on a 50-50 basis. But that agreement has now ended.
It is not simply about how many ICU beds and ventilators there are. It's about the effect it's going to have on our entire health system. This is why every health minister of all political persuasions said enough is enough. We need action. We need commitments right now.
Asked about hospital capacity on Friday at his press conference before National Cabinet, the PM was putting the pressure back on the states.
We'll be considering that again today. But I don't think the pandemic should be used as an excuse for shakedown politics. They just need to get on with the job, get their hospitals ready. We have showered the states in cash.
That National Cabinet is not yet even considering these big dollar questions about the health system points to the crossroads it has reached in its history. there has been a fundamental breakdown in trust in National Cabinet.
Many states and territories have just point blank refused to agree to papers we haven't even seen. We have seen time and time again that even noting a paper at National Cabinet is then taken to be agreement, and then certain sections of the media in particular then prosecute it very aggressively as you've signed up to this. There's been a bit of a depletion of trust in the process.
And there is the question of National Cabinet status in Australia's governance. In a brawl about access to National Cabinet documents under Freedom of Information laws, the federal government argued unsuccessfully in the Administrative Appeals Tribunal that National Cabinet was a subcommittee of federal cabinet, meaning documents prepared for meetings could be classed as cabinet in confidence and therefore beyond the reach of FOI laws. Having had that assertion rejected by the legal system, the government is now trying to push legislation through Parliament to exempt the papers from scrutiny, forcing scathing assessments at a Senate inquiry.
It's frankly bizarre legislation. They don't need to assert that this thing is a committee of cabinet. So the question is then, why are they doing it?
But the ACT Chief Minister thinks there is a middle ground to be reached on secrecy.
I think we've got to find a spot in between the old arrangements and then what is proposed in this legislation that provides the sufficient amount of protection during a decision-making process is put in place, but not much beyond that.
Whatever the government does to keep National Cabinet private, the health funding debate looks set to become increasingly public as the reopening gathers pace, case numbers rise, and a federal election looms.
Hi, I'm Lee Sales. Thanks for watching this story. If you'd like to watch more of 730's stories, they are on the left of your screen. And tap on the button below to subscribe and get the latest from ABC News.